Good afternoon, sir.
Hello.
Good
Hello, you
afternoon,
can hear
doctor.
me?
Good afternoon, doctor.
Good afternoon.
You're audible. We
Yeah,
can
yeah,
hear you.
yeah.
Sir, just a minute. Please
Yeah.
wait a minute.
एक लिए शेयर करने को पहले प्रेजेंटेशन सांगा दिसता म्हाका दिसना मरे
You can hear us?
Hello,
Hello, yes, doctor.
Yes, sir.
you can hear me?
Yes, sir. Yes, sir.
You can see the my presentation.
Yes, yes.
Yes, sir.
So you let me know when to start.
Yes, sir.
Yes, sir.
No?
Ma'am, your microphone is off.
Hello.
Thank you.
Hello.
I request, yes, hello. Yes. Doctor, can you hear me?
Yeah, yeah.
Okay, we are starting with this session. I request all the participants in this session to kindly turn off their microphone and their cameras. We are starting with this session. So, good afternoon, everyone. It gives me immense pleasure to welcome you all on behalf of Women's Cell of Rosary College of Commerce and Arts for the state level webinar on awareness and prevention of breast cancer. Breast cancer is by far the most common cancer amongst women worldwide, both in developed and developing countries. The Breast Cancer Awareness Month is always marked in the month of October across the world. It helps us to focus our attention and support the awareness on breast cancer. It is our privilege to have eminent oncologist from Goa, Dr. Shekhar Sarkar, as resource person for today's session. I extend a warm welcome to you, sir.
Thank you.
Before we start with the session, I'll just give a quick introduction of Dr. Shekhar Sarkar. Dr. Shekhar Sarkar is the renowned oncologist from Goa, and he's very well known for his single-minded crusade against growing menace of tobacco in the country. He has resorted to the various activities, right from propaganda to legal course, to emphasize his unyielding resistance to the single most killer in the land, tobacco. Dr. Sarkar has worked at the reputed Tata Memorial Hospital in Mumbai, Sion Hospital in Mumbai, and Sushrusha Hospital in Dadar, Mumbai. His presence and active participation at the prestigious international conferences concerning oncology has been a regular feature. Presently, Dr. Sarkar is General Secretary of National Organization for Tobacco Eradication, India. Dr. Sarkar believes in taking the message straight to the masses. He has been motivating factor behind organization of several tobacco cessation clinics in the state of Goa. He has conducted and he conducts the countless lectures and held PowerPoint presentations to spread the anti-tobacco message among vulnerable sections, including students and women, and also regarding awareness and prevention of breast cancer. He is the past president of Indian Medical Association of Goa State and Biomedical Waste Cell. He was president of Association of Surgeons of India, Goa chapter for 2 terms. He also was the chairman of Goa Medical Council from 2011 to 2016. He is a joint secretary of Goa Cancer Society. He is also the president of coveted Gokarma Oncology Association and Medical Trust, which is an association of doctors working in the field of cancer from Goa, South Maharashtra, and North Karnataka. He has won several prestigious awards, one of them being he was felicitated by IMA Goa State by Sri Michael Lobo, Minister in the presence of Dr. Ani Mehenderita, President of IMA Goa State. He was felicitated by Adar Shiva Sangh by Chief Minister Shri Pramod Sawant for service in medical and social service. Presently, he is the Chief of Department of Oncosurgery, Manipal Hospital, Goa. Without further ado, I request Dr. Shekhar Sarkar to share with us his insights. Over to you, Dr. Shekhar.
Hello. You can hear me?
Yes, it's
Hello.
clear.
Okay.
Yes, doctor.
You can see my presentation also, no?
Yes.
Okay. So let me start with this presentation of breast cancer awareness. As you all know that breast cancer is one of the most common cancer all over the world as such. And if you see these slides, it is very easy to make out that breast cancer has overtaken cervical cancer, which was the #1 cancer throughout for last so many years. So now in last 1 decade or so, breast cancer has overtaken #1 because the first it was cervical cancer. Cervix is a mouth of the uterus. It was very common that time, but now breast cancer is #1 cancer. And over a period of time, there are a lot of cancers which has decreased, and there are some cancers which has increased. The cancers which has increased is the most important is breast cancer. You see this #4 breast cancer, which was #4 about 15 years back. Today it is #1. So also there are a lot of cancers which have decreased. So like a brain cancer and all as on decline. There is a melanoma cancer is on decline. Even pancreatic cancer for that matter is on decline. Hodgkin's lymphoma is on decline. So there are some cancers which has gone down, some cancers which has gone up. and there will be approximately around 6% rise in breast overall cancers and breast cancer as such. In every year, there will be little rise, but we are much better than Western country. If you see here data, the breast cancer average is around 25 to 26 ladies out of 1 lakh ladies. If you take 1 lakh ladies, around 25 to 26 ladies will develop cancer. But compare it with the Belgium, Netherlands, and other things, they are all around 80 and above. And in USA it is around 150 to 200 per lakh of population. So comparatively, we are much better. But if we don't take care, it won't be far that we will reach to that figure of 80s and 100s and 150 and all. See this, which I have shown that this slide. If you see around in the urban cities like Mumbai, Bangalore, Chennai, and all, it's around 30 to 40s. While if you go to Barshi, which is a rural area, it is around 8 to 10. That means it is more common in the what you call it the more urbanized center you go, it's likely to be having more common. Now, if you see this slide, it is very common to see that it is increasing in the age group of 30 to around 50 to 55. So 30 to 55 is the major ladies in this age group will get maximum chance of getting breast cancer. Now, this is a very important slide which I want to tell you. See, what is in blue is that means in 25 years back, what is the statistics? And what is in red is now the present. See, everywhere except maybe 50 to 60 and 60 above. After 50, there is a. Hello?
Sir, can you
Hello?
do the PowerPoint presentation? We can't see the slides. Only one slide we can see.
No, it's one only. At a time, one slide only will be there. It's a PowerPoint presentation only I'm doing.
Only one slide which you had presented before, only that is there. We can't see
Eko
the
slide
other
is the,
slide.
we can't see the other slides. Just hold on, huh? I'll just see.
Yes,
You can see
sir.
this slide.
PowerPoint is not Kankan son of it.
You can see this slide.
Kankan is son of.
Sir, kindly do the slideshows.
Slide show. You can see now.
Yes, doctor, we can
Hello?
see.
Okay, so this is the important slide, which is the most important slide. You see that 25 years back is the blue color and the red color is the present situation. So the cancer is rising right from 20 to 30, 30 to 40, 40 to 50.
Sir,
Up.
excuse me, sir.
Hello. Yeah. Yes.
So it's
So the
still on
problem is
the title
it's
side.
stuck on the first slide. You have to change. You have to keep changing the slides. So only the first slide is displayed.
Resume.
We can see the other slides at
Simply-
the side. So you have to open the other slides also.
Hello.
Yes, sir.
You can't see the running slides. You can't see every time
No,
I change
we
the slide.
So on the red taskbar, you have to.
Resume. Now at least you can show the slides. Can you see the slides?
So on the red taskbar, no, where there is notes, commands, all that is written, no, you just click on that first second, the fourth one. Sir, kindly present the whole slide.
It is chat. This one is show everyone. And then this presentation. Sudhira का पहिला मतलब
Can you see it now?
hello. Hello.
Doctor?
You can
Yes.
see it now.
We can see the age distribution.
Now. Next
Yes,
one.
yes. Yes.
Now. So now this one you can see now.
Yes,
Breast
yes.
care incidence.
Yes, doctor.
Okay. So you see these slides, there is definitely increasing trend of cancers right in the age group of 20 to 50. And after 50, then actually the cancer is decreasing. So we have to be more worried about the maximum cancers are in the age group of around 30 to 50. So that is what is important, and the cancer is rising in this younger population. Now you can see the slide, no? Next.
Yes,
Hello?
sir.
Hello. You can see
Yes,
the
sir.
slide,
We
no?
can
Now?
see.
New ones?
Yes,
Yes,
sir.
sir.
Okay.
Yeah.
That, yeah. So now there is definitely rise of cancer since 1982. If you see, there is going to be rise of cancer, and this rise of cancer is going to be there. Is going to come because people have, the lifestyle is going on changing. Now, what is the problem with compared to India and the Western population? One important thing you have to realize: compared to West, our patients are younger. That means young, right, from 30 to 50. And if you see Western countries, there most of the patients are after the age of 60. Then once you are younger patient, that means your menses are on. Once the menses are on, that means the estrogen secreting on your body is very high. And continuous estrogen secretion is the major cause of this cancer. And when you have pregnancy, the estrogen decreases, the progesterone, which is a good hormone, which maintains the pregnancy, comes in. So pregnancy actually helps in the mother in decreasing her chance of getting breast cancer. Third thing is there is a receptor negativity. That means either you are sensitive to estrogen receptor, progesterone receptor. If your progesterone receptor and estrogen receptors are positive, then you will likely to do well. So our population is in more of an unfavorable group. So it is important to realize that we should come early. Once you come early, then only you can have good chance of cure for you. If you see this slide also, it is very common compared to India and compared to the West. In the West, there is more of elderly population which gets the cancer. Now these slides are very important. Just go through. It will be a very interesting for you to realize that the more you try to earn, that means you are in a low earning age group. Means if you are in a low earning capacity, your chance of getting breast cancer is 12.5 per lakh of population. If you increase your that to highest level of income, then the cancer also increase. That means the more and more you become rich, the more and more chances that cancer of the breast will increase. Same thing with literacy also. The more you study, the more the chance of breast cancer. Now it is nothing to do with the study. It is nothing to do with your income. It is a lifestyle which changes with the money, and it's a lifestyle which changes with your education. That is what is very important. In terms of religion also, if you see the religion, the highest chance of getting breast cancer is in the Parsi community. That is because they are very small community. They marry within themselves. The genetic part is very highly they marry late. They have less children. So all the negative factors are running in this. The least chance of getting breast cancer is in the Muslim community. That is because their breastfeeding is the best in the Muslim community. The minimum feed to around 2 years. Christians in Goa are at high risk because we don't have Parsis. So Christians become at high risk because their lifestyle is more like a Western. Their eating habits are more of red meat, more of cheese and butter, more of career oriented, marrying late, having less children, less breastfeeding. All these things is going on in Christian families, and Hindus are in between all these things. Where you stay also is very important. I'll give you this: Mumbai. If you stay in Mumbai, your chance of getting breast cancer is almost 30 to 40. While in Barsi, it is around 8 to 12. Barsi is a small village in Usmanabad district in Maharashtra. So it is for last so many years also, it has increased from 8 to 12 only. While in Bombay now it has gone up to the 40s. It's important. It is not the place, but it is urbanization which is the important. With the urbanization, you change your lifestyle. Your lifestyle changes. I will tell you what is this lifestyle. So one good thing which is happening in breast cancer is though your incidence is rising, that means the chance of getting cancer increases, but you dying of the because of breast cancer, it has gone down. If you see this slide, the breast cancer deaths are coming down. That is because of such programs like your program, which I am doing. This program is very important because it spreads a message that if you can come early, we can save you. The more the people are chances of coming early, so that the death rates are less. And the second is better therapy is available now, better treatments are available. So your chance of getting death in a breast cancer has decreased over a period of time. Now, what are the other causes of cancer? Now that we are in the cancer, I will just like to highlight some of what are the causes of cancer. The first thing you have to realize that we don't know the exact cause of cancer, because one who finds out exact cause of cancer is 100% is going to get a Nobel Prize, but it is not. We have some risk factors like viruses. There are some viruses which we know, HPV virus, human papilloma virus, which gives rise to cancer of the cervix. Now that we know that the viruses give rise to cancer of cervix, there is a vaccine now available on the cancer of cervix. If you take 2 shots of these vaccines over a period of 1 month or 2 months, then your chance of getting cervical cancer almost becoming nil. So once you know that something is causing that, automatically the treatment has come on. The second is tobacco. Everybody knows that tobacco causes so many cancers, right from lung to the oral cavity, even breast cancer. Those ladies who smoke high rate of smoking has got more chances of breast cancer. Diet, red meat, especially with preserved meat, that is more dangerous for the colon. Colon is a large intestine, because when you have a lot of non-vegetarian diet and with lots of red meat, then you tend to get constipated, and over a period of time you may get a colon cancer. Environment, yes, environment is very important. Asbestosis, like the workers working in asbestos producing factories, I mean sheets, the asbestos sheets which are there, which you put on the house, they are likely to get lung cancer more, because those small particles of the asbestos settle in the lung. Genetic, which you are worried much, but it's not much. It is there, but it is not much. It is only around 5 to 7%. That means it is seen normally in breast cancer, you've seen in ovarian cancer and colon cancer. Now, what is this 7% for you? For you people, suppose we take 100 ladies who don't have breast cancer, and then we take 100 ladies who have breast cancer. When you don't have breast cancer, suppose one daughter gets cancer out of 100, here there will be 7 daughters will get. That means anyway 93 daughters will be free of cancer. So you don't have to really worry much about this. But there is little genetic base is there. But the most important, what I'm highlighting, like income and education, is change in lifestyle. Now, what is this change in lifestyle? First is because of our number of children have come down. Number of children has come down. That means the less pregnancies. Less pregnancies means estrogen is continuously acting on you. There is a less chance of progesterone factor, which is a good factor, coming into this. Yes, it is not possible to tell everybody to have more children, but at least 1 or 2 children, at least 2 children. If you go by statistics of Goa, our average fertility rate is 1.7. That means some families will have 1 child, some families will have 2 children, that's all. Almost 25 to 30% of the couples don't have children at all, in spite of they trying hard. So that means they are already on a high risk. Now, because you have less children and you are working mother, then your chances of breastfeeding is much less. Minimum breastfeeding required is 6 months. Maximum is 2 years is the best, but 6 months at least you should do. But what happens, because the mother is working, she tends to give only for 2 or 3 months, and then she wants to join back. So, she does not breastfeed. And it is also a risk factor for mother to get a breast cancer. Now this breastfeeding helps the child also, because child's also immunity is better when your mother is breastfeeding. Late menopause, that means additional estrogen acting on you. That means your monthly period stops only at around, suppose around 50, or 51, 52, 53 also you continue to have menses. That means estrogen is continuously acting on your body. Late marriage is very important because early, like suppose I'll give you example. Suppose you start menses at the age of maybe 13 or 14, and you marry at the age of 35. That means there is a continuously almost 30 years of 25 to 30 years of estrogen acting with no pregnancy happening in between. So late, you don't have to marry very early. You have to marry somewhere around maybe 25, 27. Have your first child fast, because that pregnancy prevents you from getting a breast cancer, because estrogen levels come down during pregnancy. So the same thing is late pregnancy. If your first child born after the age of 30, you are increasing your chance of getting breast cancer by around 25 to 30%. So it's a very simple one. This that you should marry little early, have first child before the age of 30, can decrease your chance of getting breast cancer by almost 25-30%. It's a big number. And last one, which is important, is because of our eating all this junk food and all, burgers and all those, colas and other things. Obesity has come as a big factor in the risk factor, even in the breast cancer, not only in other heart conditions and other diabetes and all, but even in the breast cancer and all, obesity is a significant factor. Now these are the changes which are occurring because of change in our lifestyle. So the more the education, more the late you will marry, more the late you marry, the more the late children, and you will increase your risk. More the money is there, more the junk food you will eat, the more the obesity chances. So all these things which I have told you, that more increase in money, increase in literature, it's not actually money, it's not actually education, but it is the change in lifestyle which comes with these things. Now, what is this, how it develops? If you see this, you can see the sliding, no? You can see the slides. Hello?
Yes, doctor, we can see.
Okay. So now I'm coming to the breast structure. The breast has got a lobules, and they have ducts, and it comes out through the nipple, which is like a milk forming this. Now you see here what normal cells look like, a very nicely cohesively fed cells there. Then there is little hyperplasia. That means there is little increase in number two picture. Then there is something like as atypical ductal hyperplasia. Mark meter. Then comes ductal carcinoma in situ. Carcinoma, it is a cancer, ductal carcinoma in situ, but it is not coming out of the duct. See, when it comes out of the duct, then only we are worried, because if it is inside the duct, it does not spread. So inside the duct, it may remain like there only, but you will never die of the cancer. The cancer will become a dangerous when it starts invading the surrounding structure. Which now we see, like this is this we can see that cells which you can see, very high power cells, they are all stuck cancer. Then we get and these are the structure. Once it comes out, it goes into the blood circulation, and then it goes to the liver, lung, brain. See, there are three important organs. One is liver, one is lung, and one is brain. If the disease does not spread to these three organs, the patient is unlikely to die of the disease. So it is important, that can be spread only through blood. So if we can prevent the blood spread, that means we operate before the cells go into the blood circulation, or for that matter lymphatics, then we can give a good life to the lady. Now, what are the warning signals of the cancer? This is very important. Now that we are on cancer, you should realize when you should come to the doctor. Not only in the breast cancer, I will try to tell you what are the symptoms when you should come to the doctor. First, this is like a caution I have to tell. Change in bowel or bladder habit. That means if your bowel habits, which are normally normal, you get up in the morning, you go for motion, and then everything is normal. Suddenly you find that you are having lots of blood in the urine. Suppose you have 2-3 days, you have constipation, which is followed by loose motion. Again, it is having blood in that, mucus in that. That means there is change in bowel habit, then you must come to the doctor. Bladder, that means when you pass urine, you suddenly find that there is blood in the urine. And it is painless. Suppose we are passing blood and it doesn't pain you, that means you have to worry. Then you must immediately come to the doctor. Because painful blood in the urine is likely to be because of stones. Then second is any ulcer or in the mouth, in the cavity, mouth oral cavity like on the tongue or the buccal mucosa. Suppose the ulcer which does not heal over a period of around 1 month, you must come to the doctor. Unusual bleeding or discharge. Your monthly period has stopped. Suddenly you find after 1 year that monthly period has restarted, or there is white discharge which is mixed with the blood. Continuously there is no respite from menses. Continuously you have menses. Then you must come to the doctor. Any lump in the breast, any lump in the axilla, lump in the neck, lump in the groin, anywhere any lump, 90% of lumps are benign lumps, but you don't take that decision. You come to the doctor, let him check, and if it is negative, he will tell you. Indigestion, that means you are having normal food, suddenly you find that after taking some food, you don't feel like eating food, your weight decreases, constipation is there, then you must come to the doctor. Next comes swallowing. That means suppose you are eating properly, suddenly you find that you will have to take water to push the food down. The food does not go in, you feel like vomiting, and slowly, even only water can be done. That means you have to come to the doctor immediately. Then comes any change in wart and mole. So you have a mole which is quite okay, nothing is going to happen. Suddenly you find that recent time it is increasing in size, or maybe it is itching, it's causing bleeding. Then you must come to the doctor. And continuously cough. Most likely cough in India is likely to be because of tuberculosis, because tuberculosis is very common. But first you have to rule out that it is not because of cancer. And continuous hoarseness of voice. Hoarseness of voice is very common in teachers, but that doesn't mean you have cancer. But continuously hoarseness, not coming back to normal after rest also, then you must come to the doctor and investigate. Now, what is this cancer sign? You all will feel that you have one of these symptoms, because these symptoms are very similar to other normal problems also of the life. But if your symptoms don't subside, and it is a time to go to the doctor and let him decide that you have some problem or not, you don't take a decision on this. So these are the warning signal. This is the caution which you should take. That doesn't mean you have cancer, but you must come to the doctor. How it can be presented. Now I'll give you some presentation how the cancer looks like on the breast. Now one first upper left slide which is there, which is showing dimpling of the skin. Dimpling of the skin, that means something is pulling the skin inside. This is a sign we should come to the doctor immediately. To that right there is retraction of the nipple. That means nipple which is outside, which is normal looks like. Suddenly you find that recently there is a slowly the nipple is going inside. Then you must immediately come to the doctor. The lower thing is showing that it's a very advanced cancer, but it is like a orange pill. It's like inflammation is there, and the skin looks like a orange pill skin. Then you must come to the doctor. Then one nipple up, one nipple down. If you see in the mirror and you find that the both nipples are not in the line, it is normally around 1 centimeter is there, but it is definitely much more. Then you must come to the doctor. Excoriation of the nipple or bleeding from the nipple. Slowly the nipple disappearing, and the ulceration is there. Then you must come to the doctor. So these are the normal presentation. But you don't wait for all these things, because if you have all these things, it automatically becomes advanced cancer. And sometimes it's a big tumors, but they are innocuous tumors. Because if she is healthy in spite of such a big tumor, that means it is not a very powerful tumor. A good surgery, good radiotherapy will cure this lady. Early diagnosis is important. One thing you have to realize, anything which is you come to us after you see a big lump in your breast, then it is already delayed. It is already stage 2 and above. If you want to detect something early, then only thing which is available is a mammography. Now mammography can detect almost 5 millimeters, 10 millimeters, even microcalcification can be detected. Now this slide which is showing us very small whitish tumor there, I can assure you no doctor in the world will be able to tell you have cancer or not. Unless you do a mammography, you will never be able to know these things. Then once you come to the doctor, what we do, suppose you have a swelling in the breast, we hold that swelling, you put a small needle inside, aspirate some few cells, keep it on a slide, And if the pathologist is there with you immediately, then you can within half an hour to 1 hour, you will know that you will have cancer or not. Very simple test. But this is not a 100% test because there are only few cells which are aspirated. If this is negative, then we have what is called a true cut biopsy. That means this removes the tissue, not the cells. It removes the tissue under local anesthesia and ultrasound guidance. We push this inside gun and just fire the gun. It brings out a small core of tissue. It takes time, around 4 or 5 days, but they will give you a good report. Sonography, all you must have known what is sonography. Sonography of the breast is not only important in a younger generation, but sonography can detect so many cancers, especially abdomen, right from liver problem, anything in the spleen, anything in the ovaries, anything in the uterus, anything in the kidneys, any glands are there in the abdomen. So the cheapest investigation which is available today is the ultrasonography. Then we come to the CT scan. So suppose CT scan is a costly affair because it costs nothing less than 5 to 10,000 rupees, and unless we can't make out anything, we'll do a CT scan. CT scan will tell you almost to the tune of maybe around 1 centimeter or half a centimeter. If anything is there, we can pick up very easily. Then there is something like bone scan. If you have a bone pains and you can't detect anything is there, there is something like bone scan which you can find out if the disease has spread to the bones or not. Then there are some blood markers. Blood markers means you just take a blood sample and you will know that sometimes you have cancer or not. CEA is a cancer marker for liver or intestine, large intestine. CA 19.9 is for pancreas. CA 125 is for ovarian cancer. CA 15.3 is for breast cancer, and PSA in males is for prostate cancer. So these are more or less 75 to 80% correct. Sometimes you may have high things because of some other chances, but if it's high, you definitely need investigations. Now this is a very important part. Now we are coming. What are the stages? There are 4 stages in the cancer because it's very important to know which stage you come to the doctor, because your survival depends on which stage. That's why I'm again and again saying that if you come early, we can almost give you a good healthy life. If you come late, you may just prolong your life, may not be very healthy, you'll spend lots of money on that also. So there is stage 1, stage 2, stage 3, stage 4. Stage 1 is a small tumor which is shown there. It's less than 2 centimeters. Then you are in stage 1. Nowhere disease is there. Only in the breast, 2 centimeters and less, you are in stage 1. Stage 2 is 2 centimeters to 5 centimeters. Nowhere else the disease is there. This is called as early breast cancer. Stage 1 and 2. Then comes stage 3, which is like locally advanced cancer. That means the disease is still in and around breast. So that if you have any size of breast plus axillary glands, there are glands in the axilla which are positive, then you become locally advanced breast cancer. And last stage is one from breast. It has already gone to the liver, it has already gone to the lungs, it has already gone to the bones or brain. That means it has gone out of the confinements of the breast. Now why this is important? Because if you come in stage 1, your chances of getting all right is up to the tune of 95%. That is almost normal life you have. If you come in stage 2, that decreases to 80%. That means 15% drop by simple increasing size from 2 centimeters to 5 centimeters. So average around 1 to 2 stage is around 80% and above, you can have absolutely good life. This is like a early. So you come early, you will have an absolutely good life. In stage 3, that is drops to around 50 to 60%. That means around 20% to 30% drop in survival. And in last stage, you have to be extremely lucky to survive. The God has to be there with you round the clock. Now, what are the advantages of early diagnosis? It's very important to know. 3 advantages are there. Early diagnosis will give you good life. That is 100%. Your survival improves. You have almost normal life. Second thing, you can save the breast, which I am showing you. Before the breast is almost normal. After surgery also it looks normal if you come in time, because we have now oncoplasty and all. We do the plastic surgery and the breast looks absolutely normal. But if you come late, you will have to sacrifice the full breast. Yes, you can do reconstruction, but they are never as good as what is in the first slide which I will show. And the third thing which is helpful if you come in early is you spend less money. You will spend less money on the early cancer and you get a good life. But if you come late, you will spend lots of money, lakhs of rupees, and then still you will not have a healthy life. And these are the five treatments which are available for breast cancer. First is surgery. As you know, first one surgery and radiotherapy. Surgery is a local treatment. That means you remove the tumor immediately, you remove the glands, and you send for reporting, and that report will give you what type of cancer it is. It is spread to the glands or not. So it is a local treatment of the cancer. Almost 50 to 60% of the people get totally all right only by surgery. Radiotherapy is like a radiation which kills the cells. Suppose we have a surgery done, we have no, it's more than 5 centimeters. Some cells may have remained there, so we give them additional radiotherapy. If you have conserved the breast, which I was shown the first slide, that there is a not removal of the full breast, then we have to give radiation. Third is chemotherapy. First and second is a local treatment. That means it will not prevent the spread unless you remove it in time. Chemotherapy is the one which will go everywhere in the body except maybe a brain and kill the cells in other systems also. Suppose it is in the blood circulation, if it is, goes into the liver, lung, they can kill them. So the life which is increased is basically because of chemotherapy. Yes, it has got side effects, loss of hair, vomiting, loose motion, so many things are there. But you must complete chemotherapy because that gives you additional around 5 to 10% of the life. Endocrine, that means hormone therapy, which we see. That means if you are sensitive to estrogen or progesterone, we have now anti-estrogen tablets which you need to take for almost around 10 years. And the last is targeted therapy, which is normally used in very advanced patient, very costly treatment, pulse base and other things are available, but it gives good prolongation of life and with good quality of life with less side effects. So these are the treatments which are available. One thing to how you can diagnose early. Now you have to give almost 5 minutes to yourself for every month 5 minutes. I'm not asking for more. Every month 5 minutes for yourself. Suppose if you are having menses intact, then you should do fifth day after stopping menses. And if your menses are over already, then first day of every month. So every month you have to do 5 minutes and examine yourself, your own breast. This is called as breast self-examination. What is the importance of this breast self-examination? One thing is first is it is free because you are doing it for yourself. Second thing is the breast self-examination will give you the texture of your breast. It will, you don't have to go to a doctor. You will know how your breast feels, what is the normal breast. And if there is something new thing which happens inside, you will be the immediately one you will be able to take out. And you will know that yes, there is something wrong. Then you come to the doctor. It's very important because every time you can't go to the doctor. So you see yourself, you find any changes, you come to the doctor. That is also called as breast self-examination. And this can detect early detection of breast cancer. How to do this breast exam? It's very simple. Stand in front of a mirror and see that your both the nipples are in one line. Lift both hands up and you see that both the nipples are symmetrically coming up. That means your breasts are normal. One nipple is coming up, the other nipple is coming down. That means your breasts are abnormal. If you see that both the nipples are symmetrically coming up, that means your breasts are normal. One nipple is coming down, that means your breasts are abnormal. Both the nipples are symmetrically coming up, that means your breasts are normal.
Doctor, doctor, we can't hear you. He's stuck, no? I request all the participants to kindly stay in the meeting. I think there is some technical error. Doctor will rejoin. Please wait, don't leave the meet. Thank you. Participants, kindly wait. I am really sorry for your inconvenience. We have tried to contact the doctor. Please wait, and thank you so much for your patience. Kindly wait. Dr. Shekhar Sarkar have rejoined. So participants, we are starting with the meet. We will continue soon. Dr. Shekhar, can you hear me?
ऐसा actually है ना सर?
Doctor,
हाँ,
we can see you.
seeing me? Hello.
Yes, we can see you now.
Okay. You tell me your queries. I hope you
Yes.
have heard something at least. Or you
Yes, doctor.
Mhm.
We were on that previous slide and then the video was disabled, I think. Then you had left the meeting. Did
But
you
you could
say
hear me at least.
something? Yes, yes. Did you say something in the end before we couldn't see you?
Uh, what you want to say? Any quick queries?
Did you have any concluding remarks? We did not hear that. What you
No,
said in
concluding
the
remark.
end.
I will make concluding remark.
No, no. In
Hello.
the sense
You
when
can
you
hear
were
me.
talking. Yes, we can hear you.
Uh,
So
you can
when you
hear
were,
me, no? I will make
yes,
a concluding remark is very important that you have to come early. The message is very clear. If you don't come early, you will not have a good life. You will never have a good long life paper. So if you come early, you are in stage 1 and 2. You are almost 80 to 90% chance that you will become all right. If you come late, yes, still you have some chances, but the chance decreases drastically. Because in stage 1, it is almost 95%. Stage 2, it is around 80%. Stage 3, it becomes 50%. And stage 4, it becomes almost to the, only God willing. So it's very important that you must take care of yourself because you are the center of the family. If you are well, full house is under control. And now with the new concept of nuclear family, it is important that you must be healthy because if you are sick, then the full house is in shambles. Previously, there used to have a joint family, and there were a lot of support system available from other family members. Now there is no such support is available, so you must have a good support system. And very important to realize that one message has to go that don't wait for some excuses. मित्र मंडळी आज शिरगावची जत्रा असा फाल्यां कोणाचें लग्न आसा कोणाचें साखरपुडे आसा सी ऑल दीस थिंग्स कॅन वेट बट युअर हेल्थ इज इम्पॉर्टंट सो द मदर ऑफ द फॅमिली ऑर द wife or the daughter has to be the extremely important. They should take care of their breast as well as for other cancers also. Hello.
yes, doctor. Thank you so much. Doctor, there is one question here for you. Uh, Ms. Jevali Pereira is asking whether a male can be the carrier for the breast cancer.
Carrier means
Can male have the breast cancer like how women have?
yeah. Male also can have a breast cancer, but chances are very less. For every 1,000 ladies, there will be one male breast cancer. It is very less compared to the ladies. Ladies are the most common because the estrogen acting on them is very high.
Thank you, doctor. Are there any more questions? Participants, if there are any questions, please post it quickly because we are almost at the end of the webinar. Are there any more queries?
Hello, doctor. Good day, doctor. Doctor, since you said it is genetic, is it possible whether a male can be a carrier?
No, there is nothing like carrier and all here. You cannot transfer from one this like a contagious disease. Cancer is not contagious disease, and it is like a breast cancer is genetic is base is there, but it's around only 7% as I told you. From like mother to daughter, the chances of getting is only 7%. Problem is if mother and her sister also are positive, then the chance becomes around 15%. But suppose mother, sister, and grandmother also is positive, the chance becomes 30%. The more in the family, the more the chance of having breast cancer. But only if mother is having breast cancer, the chance of other having breast cancer is only 7%. It means 93% of the children will not have any problem.
Thank you, doctor.
Thank you, doctor.
There is one more question by Leela Navelkar. She's asking, what are the ways to prevent the breast cancer? How to prevent it?
Prevention is that means one important factor is that don't one important factor you have to marry in time. That means somewhere around 25 to 27. Have first child before the age of 30. good breastfeeding, at least 2 years, if not 2 years, at least 6 months, and stay away from alcohol, smoke, and all these things. Keep yourself fit, have a lean, thin body. I think you should be away from the breast cancer.
Thank you, doctor. There
One
is one
question
more.
is fibroadenomas.
Yes.
Can tell fibroadenoma is a benign tumor of the breast cancer. It is a very common, and you don't have to worry. You are there's no need of every time that you should remove a fibroadenoma. But if the size is increasing, then it is safer to remove that rather than keeping it inside. But it is a benign. You don't have to worry. It's a classical tumor which just moves in the breast. We call it a rat in the mouth, in the breast. It moves there. So that is a fibroadenoma. It's a benign tumor of the breast, so you don't have to worry. It will never turn into cancer. I can't hear you.
Yes, thank you, doctor. There are no questions anymore as of now. There is one instruction for the participants. We have posted a feedback form in the chat box. Kindly fill the feedback form for receiving the e-certificate, which will be sent on your registered email IDs. Doctor, there is one more question coming here. Does drinking hot beverages or hot water
No,
most of
no.
the time
But
lead
it
to
can give
breast
rise to
cancer?
esophageal cancer. So you must always drink tea and other things which is a little cool down. Don't have a very hot food because esophageal cancer and oral cavity cancer are common with those people who drink very hot tea.
Thank you. There
And
is one more question.
pregnancy. That what was the pregnancy question?
If one has breast cancer survivor, then does it have effect on the pregnancy in future in that patient?
No, if she wants to have a baby after the breast cancer, then she should wait for at least 3 years to 4 years. Means we normally tell them to go ahead for the pregnancy if we are thinking that the mother is the tumor is very good and she is likely to survive good, then she should try for a child. It's not a problem. Previously, we used to say that they should not have children, but now we are giving them options, and especially sometimes we save their ovaries prior to chemotherapy and all, so that they can go in for a pregnancy later on.
Thank you, doctor. There is another question by Alfia. She's asking to repeat those slides. You can actually just give it in brief about, how to detect it, how to examine one's own breast.
See, the breast self-examination is the simplest thing. You have to just stand in front of mirror, see that both the nipples are in one line. Normally, there is a little 1 centimeter up and down nipple is there, but you don't have to worry for that. But when you lift both your hands, both the nipple has to be symmetrically upwards. If one is going more, one is not going more, then that means something is wrong with the one which is not moving. There's something is holding it back. Then you examine the breast either in by circular method or by the vertical method by palm of the hands. So that when you have, I can show you that palm of the hand, you hold like this and either you do like this or you do like this. In standing position, with the right hand, you examine left breast, with left hand, you examine right breast. After some time, you can lie down and do the same activity. What is the concept of this breast self-examination? That once you do this regularly, you know that what is the texture of the breast. If something new happening inside, then you will be able to pick up fast and then you can come to the doctor. That is the concept of breast. So once you know what is the normal concept of your texture of your breast, it will be easier for you to do this. Second thing is very important in the breast self-examination is that it is free and it should be done just 2 minutes in a month. One who is having a regular menses, it should be done 5th day of the menses, and one who have stopped menses, it should be done 1st day of every month. It's the early diagnosis can be done only by these two methods. One is breast self-examination and second is by mammography. Okay. I can't hear you.
Yes, sorry, doctor. One last question by Frenita Gomes. She's asking, after surgery and chemotherapy, if the patient is cured permanently,
Immediately, only in the movies you can get permanent cure. Because in the movies only they said that you are now okay now. In practically, you have to live for 5 years, then only we give you cure certificate. So you have to, after all this treatment is done, you have to come for regular follow-up, regular test has to be done, and then once you complete 5 years, we consider it as a cure. But normally what we tell patient, if you come in a very early stage, that you are good. That means your chances of survival is better. But only in movies you will know that yeah, everything is went off wall, everything is okay immediately after surgery. Nothing happens like this in the actual time. I don't sleep for 10 days if I operate on the esophagus and lung. In the movies only you say everything is fine. 10 days the patient घरा वाचा म्हणजे नीट पडना. So it is not easy to just say that everything is fine. But we know that if you come early, your chance of getting all right is very high.
Yes, thank you so much, Doctor. That was really a guiding and wonderful talk. I'm sure the participants have understood and they are aware about this breast cancer issue. I may now request the convener of the Women's Cell of Rosary College, Ms. Lizen Fernandez, to deliver the vote of thanks.
नावा बोलून मी सगळ्यांनी कोण पण ऐकत नाही तर देऊ पण नाही.
Good afternoon, everyone. It's my privilege to propose the vote of thanks. First and foremost, I would like to thank the resource person, Dr. Shekhar Salkar, for giving us his valuable time and providing an insight on the topic, awareness and prevention of breast cancer. I would also like to thank the principal, Associate Professor Helig Barreto, and the administrator, Reverend Professor Simao Diniz, for their constant support and encouragement. I would also like to extend my gratitude to all the participants, students, faculty from different colleges, teachers, and the public. Your overwhelming response has led to a great success to our small initiative. Lastly, I would like to acknowledge the efforts of the staff of Rosary College for assisting us in conducting this webinar. Once again, thank you all. A small reminder, kindly fill in the feedback form to receive the e-certificate. Thank you.
Thank you.
Thank you.